Hello, good afternoon, everyone. How are we all doing? As you can already see from the title of the video, um, I want to talk about recognition of prior learning, specifically that. I have already made a video where I talked about um how to fill the qualification form just in case your school is having issues and they ask you one or two questions, what information is needed there, how to get those informations. And recently there has been just a little bit of changes from NMBI when they included what is known as the recognition of prior learning. So someone asked that question in my comment section some time ago, and I promised to make a video about it. And because I want to also go live as well, I said let me use that as a topic for today's live, and I will talk about that. I may also make a quick video where I will post on the same topic. So what I usually do these days is if I have like a question that I need to do more explanation, I will do live on that, and then I will still make a video where I talk about it as well. So that being said, let's go straight into the video while I explain what a brief explanation of what you're seeing on the qualification form and information that is needed, and then I will only focus more on what recognition of prior learning is. So to start that video, let me give you a brief introduction about myself. My name is Indue. So I am a registered nurse originally from Nigeria, living and practicing in the Republic of Ireland now. I make videos talking about how people can do their migration process down to Ireland here on their own, just the way I did mine. Let me quickly put my phone on do not disturb because I'm seeing some videos come. Do not disturb. Yeah. So sorry for the break in transmission. Like I was trying to say, I make videos where I talk about how people can safely do their migration as nurses to Ireland, UK, any country of their choice. I've talked about how you can move to New Zealand, how you can move to Saudi Arabia. I know I still promise to make that video, which I will make. I mentioned it in one of my life like that. Yeah. So before I get into that video, I want to get my laptop where I can open the qualification form and then get to talk about everything. Okay, so just give me a little break there. I'll get my laptop and I'll be back. So if you're still watching and if you've come across this video, please let me know where you're watching from and let me know if you have any question to ask. I encourage everyone to ask questions because I remember when I was doing my process, I used to ask a lot of questions. Sometimes people don't answer, but I've made it a point to answer every question that is being asked on my YouTube channel, Facebook, any of YouTube and Facebook. My Facebook is Nduweso Sabbath, and my YouTube, as you're watching here, is all of Nduweso. So on my YouTube, you're going to get all of me. Okay, so I'll quickly get the qualification form and then I will just go through it and let us know what recognition of prior learning is. Okay. So just give me a few moments there, please. And if you have any questions, you can use this period to ask in the comment and I will answer all of you. Okay. Welcome, please. Let me know where you are watching from. Please, that will be very, very grateful for me. I should have downloaded this form already before I started this live, but now it's stressing me. I think I have it on my WhatsApp because it's not that simple to get it. You need to log into your account before you can see it. Yeah, I'll get it from my WhatsApp. So, good. I wish I can share my screen on here, but I don't think. Can only see start Q&A. I cannot see. So on the qualification form, these are the information you're going to be. You see where you have the applicant's name, which is your name, obviously, and you're going to start from first name. Hello, Barbara. Thank you for watching. You're going to start first name, middle name, and your last name, or however the most prevalent. So if it's from your last name, but preferably because in Ireland here people are addressed by their first name. So you start with your first name, middle name, and your last name. And then you would see date of birth. Obviously, it's your date of birth because you make it the day, month, and then the year. You see your qualification title, which is it would either be like registered nurse, registered midwife, or whichever qualification. It's going really well, Barbara. Thanks for asking. You see start date of the program. So on the start date of the program, you want to really be careful and make sure you confirm this with your school, because like schools in Nigeria, it is very sometimes it can be confusing because the dates you have on your admission letter may not be the dates that your school um recognize as your start date. So you want to confirm. Obviously, it's your school that is filling this. So you want to get your qualification form. Thank you, Barbara. Have a nice day too. You want to confirm with your school and make sure that you get this date correct to avoid querying. And then the date, the end date of your program. Okay. Then was it full time or part time? Most times it's full time. You state it there. And then the undergraduate or postgraduate, you check. If it was undergraduate, is below degrees undergraduate, and postgraduate is after you have gotten your BNSC already, and then the name of the college. So you would see all of the stuff. You see the clinical hours, total hours of clinical practice, total hours of theoretical practice, and all that stuff. And then when you go down, you will see where they write applicant has recognized prior learning, RPL, accredited prior learning slash accredited prior learning. So you are now, if you have it, you write in hours. So what is recognition of prior learning? That is where the question comes in. So this is something that is really simple. If you go to your Google and just type recognition of prior learning, and you want to see the meaning, you would see that recognition, let me type that again, recognition of prior learning. What does that mean? Let's get the meaning before we even go into. So recognition of prior learning describes a process used by regulatory bodies, adult learning centers, career development practitioners, military organizations, human resources, blah 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 blah, and universities to evaluate skills and knowledge acquired. So just like the name implies, recognition of prior learning, it simply means that, for example, if you are going to school to do, let's say, you're going to do masters in maybe masters in one of the specialties, and then you have and then they have like modules. They have different modules where you have to do, and you have already done this module in your degree program, and then your school can provide a transcript showing that you already offered this module. A typical example I like to use is, let's say, in your undergraduate you did something like, in your under on your under during your undergraduate you did something like, social sciences. And under social sciences there is psychology, there is sociology inside it. Okay, and you've already offered these modules within your social sciences. Now you're now going back to school to go study, let's say, psychology, and then there is a particular topic or hours that you have already done, written exams, and you've passed. So your school can decide to recognize that you have already done this. Then there is no need for you to come and offer this module again. Now I would also like to add that this may not be very common within our education system. This may not be very common. I Maybe it's common within them here, because like when I tried to apply for my degree to do, which I later dropped out. When I applied, they mentioned something like that. They mentioned that if you are doing a master's in during the induction program, they mentioned something like, if you had done your degree and you've done you've done this module, there is no need to offer it again during your postgraduate, your postgraduate diploma, any of those things. There's no need offering the same module again in this program. You just go ahead with other ones. That is what recognition of prior learning literally means. So you have already studied this course, you already pass. Let's say in nursing we have different courses like, med surg. So you already did medical surgical nursing, and not just medical surgical nursing, you've already done that during your undergraduate, and now you want to do your masters, and there is a module on medical surgical nursing. It has the same topics and everything. Why repeat it again? So when your school is feeling the recognition of prior learning, that's what it means. If you had already had, let's say, the reason you did not offer pharmacology in the school, even though it is in your curriculum, is because you already did pharmacology in your previous. Maybe you studied, other sciences, and then you happen to do pharmacology, and then you already did that. There is no need for you to do that in school. So now that the school is filling your qualification form, on this page where it is written, they are supposed to provide all your theoretical hours and your clinical hours, and then they get to that place, they do not have that, because that will like short your hours, maybe like 10 hours, 20 hours, or even up to 100 hours, depending on how big the module was. So to instead for them to continue to let you say, oh, continue doing the course, they will just allow you to finish what you've already done. So they will just they'll get your transcript from your previous school, and then fill it in there for you. I don't know if I'm making point. They fill it in there for you and said, okay, you have already done this program. So there is no need for you to do that. Okay, because we did that and we acknowledge your 10 hours, your 20 hours, your 15 hours of your prior learning on pharmacology, that's what they're going to fill in that space. That's just literally what it means. So you do not need, that's just what it means. I really don't know how to like say more than that. But if you are still confused, please drop your questions in the comments. I'll gladly answer them. But that's just what it means. Okay, let me state another example. So another example is in nursing we had primary health care. We had primary health. I remember we had primary health care one, primary health care two, where we did in year two, primary health care three that we did in year three. So you've already done all these primary health care, and then you want to go for like some of my colleagues who went further to do public health nursing. I know when public health nursing is involved, there are a lot of community health courses, primary health care courses that is there. Repeated topics are there. So that's why I said it may not be very common for schools in Nigeria. I don't know. I believe it wouldn't be very common, but that's a typical example. So now you are going to public school of health to study your public health nursing, and you already did primary health care one in your year one, you did primary health care two in your year two, you did primary health care three, you even did what we called community health nursing as a course. So your public health nursing program, they could have the right to say you have already offered these modules. You even went, because during nursing training we go for a community experience where we are kind of practicing what we've learned in class. So what we've learned in class is the theoretical hours. And then we go, that time is when we go for like visit primary healthcare hospitals where we see how people are being taken care of within the community setting. So your public health nursing school could say there's no need for you to offer these courses again. You get your transcripts from your previous school, and they recognized that you have already had these courses. They recognize that fact, and then they leave you alone. That's just what it means. So now, let's say you now want to apply to NMBI to register as a public health nurse, and your public health nursing curriculum will not be complete without primary health care or community health care nursing course. And because you did not offer it in your public health nursing program, you offered it during your general nursing program. Your public health nursing heads, as they are filling your qualification form, you write it on that space that that particular one was under recognition of prior learning. You didn't offer it with them, but you had offered it during your general nursing. So that's just the simplest explanation of how it can go. Huh? That's the simplest explanation. I hope you understand what I'm trying to say. So that's what it means, literally. Literally, that's what it means. So, but for those of us who are just say, undergraduates, or when I say undergraduate, it means those of us who did diploma nursing only, and we are to use our diploma nursing, that place is going to be new. There's nothing there, because that was just your first introduction to nursing as a whole. There's nothing, they are going to fill in there for you. Or those of us who are graduates, I mean those of us who did nursing directly from the university, there's nothing your school is going to fill in there for you, because you've not had any nursing training anywhere before. That is your first. Now, even for some of us who have had general nursing training as diploma nurses and then went to the university and then starts from direct entry, some of us even starts from, I know many of my senior colleagues who started from year one all over again, bought jam, wrote jam, had admission to do nursing. When they already registered nurses, they start from year one again. Now, that is even the set of people that could have this recognition of prior learning stuff, because I believe that many things are going to be teaching them in the university during their course of training as general nurses, because they're still going to train them again as general nurses. The only thing is you will not need to write nursing qualifying exams again, except if you want to be a midwife, then you can opt for the midwife or the public health option. You're not going to write it again to be a registered nurse, because you cannot write final qualifying exams twice for the same division. No, you can't write it twice. So during your school, those are even the set of people that could say, okay, because they already did their general nursing, there were some things that they learned, that they were taught while they were in general nursing school. So now that they are in the university studying this, they should not do this again. They will get a transcript from the previous school, and then the university will recognize that they had already done this during their general nursing training in the nursing school. That's just what it means. So if you still have questions, if you are just joining, please let me see let me see your comments on the comment section. Don't forget to like this video, don't forget to share, drop all your questions in the comment section. And there's a lot of updates there. So I promise, when I had the strength, sometimes I don't just have the strength to Merry Christmas, Stainless. So if I have the strength, I'm still going to record like an updated, because when I recorded my previous um qualification, how to fill the qualification form videos, this form was not in use at the time. This is like a revised kind of form now that they are using. So, but it doesn't mean there's not much that has changed. It's just, I think the major thing that has changed is the recognition of prior learning, and then this clinical practice component, where you get to do direct patient care. That's just the one which your school will figure it out, because they I don't know, I know in schools in Akwa Ibom, we do, as a general nurse, you, because during our days we take our exams in the hospital, we take our practical exam, we do for clinical post, we go for clinical postings. So you get to do direct patient care, you get to do a vital signs, you get to care for patient. For example, in one of these things they are saying general and specialist medicine. So specialist medicine could just be when you were um I know, because I know when we say specialist medicine, it's not when you are sent to general hospital. In my school, our specialist posting was sending us to teaching hospitals, sending us to eye hospitals, sending us to mental health hospitals. Those are specialist training. So when you are being sent to like female medical ward, those are like general surgery. So those times that you were sent to the school, they have the list. The school will put it down how many hours you spend. They know every day, every week we do 40 hours, because we go Monday to Fridays. We don't work on weekends as students, except maybe if your ward is really short staffed and they in charge just want to like, and now that students are here, especially when you are in year two, towards the end of your year two, the school, towards your end of year two, I'm talking of those that are in nursing school, towards the end of your year two, they tend to see, because by that time you already know most of the things, you can somehow manage a ward under supervision. So if you are there and there is a registered nurse, you can co-manage patients. Obviously he's signing off of whatever you're doing, is supervising you. But the only thing maybe you can do unsupervised is like vital signs. You cannot go and just give somebody injection. No, those things you are supervised. But those direct cares that are going to write them down. The next one here is like care of the older person. Sometimes we are in our hospital that time, we didn't have an older person ward. We did not have. But in the teaching hospitals they have what they call sepu, care something something, care of the elderly, something something unit, they call it sepu. So if you have been posted to those units, which obviously you will, they'll write it there. um Emergency department, most times many of us are there. If you are not in children emergency, you've been in the general emergency, you've been in the eye emergency, depending on how your school of training is like. Okay. And then operating theaters. This one I was like in operating theaters back to back, both in our general hospital and in teaching hospital. I was always like in operating theater. So those hours that you were there, because like when we go for I don't know if it's applicable to me. I believe it's applicable because even when I was working as a staff nurse in the teaching hospital before I moved to Ireland, when students come, because I was in the I unit. I unit is a specialist experience. I unit is not a place they send like year one student to come. No, you can't see a year one, especially in the university. If you are in the university, before they will send you to like I unit ENT, you should be around maybe level 400, 500. You're nearly going. That's when they send you to those units. They can't go and send somebody from PTAs to go to I unit because you're just gonna stand there, you're not gonna learn anything, so those are like specialists, and you don't get to like spend almost the entire week with them because they want to reshuffle all of you to go through round the unit. So you could be 2 days in I unit today, 2 days in ENT, 2 days in oral facials, 2 days in theaters, 2 days in children emergency, 2 days in really will they send student nurses to like NICU or ICU, because those are the places that you want to be really careful, because as a student, no matter how big you are, sometimes students still behave like students. Those are not places that you can go and play with, except they really like, I don't know why midwifery is not really a specialty, especially in Nigeria. If I want to be blunt, midwifery is not a specialty. In Nigeria, it is not regarded as a specialty. You don't get any benefit for being a midwife. You don't. I don't know if they do in your hospital, but midwifery is not a specialty in Nigeria. This is something that people argue, yeah, but we went back to school, but it doesn't mean anything. The government doesn't recognize it as a specialty. It is not. It is just, some people will say it makes you a complete nurse, but I don't see how that makes you a complete nurse, because midwifery is something you choose to do. It's either you want to be a midwife or not. And most times people just do midwifery because their colleagues are doing it, not because they really want to. Because the name just RN is like 5 and 6. So when once they hear RN, the next thing that should follow is RM. So that's how people go for thank you, Abby. Merry Christmas. Please kindly subscribe and you'll get to like more goodies coming. So midwifery is not really a specialty. You don't get any. When we say specialty, it has to be something that the government like give you extra pay for being in that field, in my opinion, and in the opinion of many. And as a midwife, you don't get that. You don't get that in Nigeria. You do not get that. You can't be on call because you're a midwife. No, you don't do call. As a midwife, you cannot even work alone, because when we say specialty is something that you can competently work alone with very minimal supervision of higher rank. For example, as an ophthalmic nurse, I can take care of different, I can set up my own eye clinic as a outpatient case, go for few trainings here and there, and I run my clinic perfectly. But as a midwife, you cannot do that. The last I know reforms happens every day, and I don't know the latest. From the one I know, as a midwife, you cannot. If you are setting at any antenatal clinic or maternity clinic or whatever, there has to be a doctor. There has to be a doctor. There has to be a doctor. Okay. So yeah, that's how it is. And you don't get call allowance, things like that, because you're a midwife, you know, like other nurses get, other specialties get. So if you are talking of specialties in Nigeria, you should be talking of things like even ophthalmology. Ophthalmology, some hospitals don't even pay. My hospital didn't pay. Even when the federal government has approved it, they didn't pay. But many hospitals paid. Many now I've heard Enugu have started receiving ophthalmic nurses in Enugu, orthopedic, ICU, theater, anesthetist. So anesthetist will only work if you are in the general hospitals, not teaching, because teaching hospitals, as an anesthetist and as an anesthetics nurse, you may not get to do your work as an anesthetist because they are doctors. It's a teaching hospital, so they have like doctors who are anesthetists. So and they are the ones like doing all the anesthetics job. They are the ones inducing giving patient anesthetics during surgeries, reviewing patients to be admitted in the maintaining patients airway when they're in ICU and all of that stuff. So if you're in teaching hospitals, there may be no need to go and do anesthetics as a nurse because it will just be a waste of your time. You will not get to, especially if you are someone that derive joy in doing what you went to learn to do. Please help me like the video. Help me like the video. Like the video. But there are so many, and you stainless, you're still a student nurse. It is better you do something that you really love, because to me, to me, I'm not really a fan of bedside nursing. It doesn't mean I cannot do it. I'm not really a fan of bedside nursing. I've always looked, in fact, mental health should have been my post basic specialty. If I wanted to do mental health, should have been, because you have a lot of, you have a lot of should I say liberal, I don't know how to say it, if you're a mental health nurse. But yeah, but when I went for my mental health experience, I didn't like the way the hospital looked. I used to tell my colleagues that if I have the mind of traveling abroad to work as a nurse, mental health is what I would have done. Because as at that time, I didn't have the, in fact, for me to even be, let's not even go there, Jagba out of Nigeria is a shock to many of my colleagues, because it is, Nigeria is my country is a country that I never dreamt of relocating. I dream of visiting, traveling to other countries, but to move with my family, so it's not something I dreamt about. So yeah, that's it. There are other lovely specialties. So, but it is very good you do what you love, because when you do what you love, I'm telling you, it makes your job a lot easier. When you see nurses complaining of burnout, it doesn't mean those things are not real. They are. Burnout is real. Tiredness, frustration, they are there everywhere. But when it is a job you love doing, those things will still be happening. But amidst all of that, you still find fulfillment in what you do. You still find fulfillment. You still find fulfillment in what you do. But when it is not something you love, my sister, you will be frustrated. Any little thing in that place is frustrating you. Any little thing is frustrating you. I remember when I was a student, many people used to run away from the theater, but theater is one of the places that I love. Like as I'm here now, if I have the opportunity to go back to school, bam, to do theater nursing, I won't even think twice. I will run and go and do it, and then come back and start working in the theater. As an ophthalmic nurse, I had the opportunity to scrub the theater, and I loved it. And that's one thing I love about ophthalmic. Ophthalmic nursing gives me, I'm not trying to advertise, I'm just saying the way I feel. And I believe that that's how everyone should feel about their specialty. Okay. Have a purpose before you choose a specialty. Have a purpose. Most times, for example, now when I was in nursing school, when we were doing our nursing K plan, I don't know if it is still in vogue now. So during your year 2, you do what I be first semester year 3. You do what is called nursing K plan. I think is it year 3? You do what is called nursing K plan. And nursing K plan, we just came back from our ophthalmic experience in Mercy Eye Hospital, Abak, and before you know it, the only I put cataract was the only, no, glaucoma was the only eye case that I put, and then I put 2 other general medicine I think I put something about inflammation of one part of the internal organ, something like that, and then one other thing like that. Before I know it, they choose cataract. They chose glaucoma for me, and I did it. And then during my and then one of us did. Yeah, midwifery is fine. You can go and do your midwifery, but the only thing is, if you go and do your post basic midwifery and you want to move abroad, you won't be able to use it immediately. It's going to be your general nursing first. Then when you come over to whichever country you are going, then you can now think of how you want to register as a midwife. As a midwife, you need to do, you will register first with your basic qualification. That is how it works in almost all the countries. Even in UK, even in US, it would be your first qualification. Psychology won't really be a specialty, except you want to go into mental health. That's where you have more of psychology. Psychology is there in all of psychology as a course is there in all of the specialties, because there's no how you are dealing with a patient. For example, in the eye section, patients, you break bad news to patients. Most times patients get bad news from the consultant. You get to tell them, oh, you can't see this, you can't see that. So it's still psychology that you're applying in there. And in mental health is a whole lot of it. And also, if you are going into counseling, if you want to maybe divert completely from bedside nursing and go into the office kind of nursing, and then yeah, but otherwise there's not really like, or you want to go into teaching, then you can do your what is it called, your masters and PhD in courses that aligns with psychology. But as a midwife, you also have a lot of options. So after your general nursing, you can go and do your midwifery, or if you've not started, if I'm assuming other people will be watching this video. So if you've not started and midwifery is really what you love, then you go and do basic midwifery, so that if you're migrating abroad, you'll be able to register as a midwife in that country. So there are many specialties. You ask, what are the specialties? From what I can get from my head right now, just count it from head to toe. Every part of the body, every part of the body has specialty. That's how you assume it first. So every part of the body has part a specialty. Okay. Then so if you are going from the brain, so brain will I would classify all of them under ICU, intensive care or critical care. I think the many places call it critical care. So critical care or intensive care nursing. There's intensive care. So when you get to eye, you get the ophthalmology, you get to ear. So ear, nose, and throat is joined together. You don't have ear, nose, so they are joined together. ENT, ear, nose, and throat. And then you have there's dental nursing. There's dental nursing if you want to go into that. There is oral maxillofacial, so they take care of the mouth, the breathing, and the throat, the face, the oral maxillofacial. So places like this, that's what they do. And then when you move down, we have breast cancer nurses. There's breast cancer nursing, but I don't think that is applicable in Nigeria. I don't think that's applicable in Nigeria. We have I have the kidney, that's renal nursing, or that some people call it dialysis nursing, some people call it renal nursing, but it's one and the same thing. We also have the orthopedic, that's the bone. We have, then when you go into theater, you have anesthetics nursing, you have perioperative. So before it used to be theater nursing, but now it is perioperative. So perioperative nurses, what they do is they scrub, basically. They scrub to assist the surgeon. So they could either be the scrub or the circulating nurse in the theater when there is any surgery. And we have the post anesthetics recovery unit, that's a PACU, that's in a post anesthetics recovery unit. So that's that as well. So those ones, basically what they do, they are literally outside of the theater. They are like the mediator between the ward nurse and then the theater nurses. So they receive patients that are coming into the theater. They do their pre-op depending on what the policy of the hospital is, and then they take them inside the theater. They wait to get the patient back. So when the patient comes out and then they stay. So but it's just that in Nigeria we don't really have that space, because I think they divide people, they divide all the pre-op nurses to do all of that stuff, because they can also do that. So they monitor them to make sure that they are stable before they get to be transferred to the ward. So we have that PACU. So when you go into children, we have pediatric nurses. We have pediatric nurses. We have even within pediatric nurses, there's also another specialty like the um, pediatric ICU. That's very different from general pediatrics. So there's pediatric ICU nurses. Um, I don't know if I've forgotten any if I remember, I may mention during the course. So yeah, that's it. Those are some of the specialties you post basic. There's public health nurses. Public health nurses even get like additional pay than midwives. Yes, they get additional pay. Public health nurses, they are the ones that work in the community. So community health nurses and public health nurses. Don't confuse yourself with the CHO. No, that's not the one I'm talking about. That's not the one I'm talking about, because I know in Nigeria it's slightly different. Things are a little bit different, because I'm like combining the two countries and talking. So when we say community health nurses in Nigeria, it is different, because they are not registered nurses. They are just community health nurses. They have their own rules and regulations. They are the ones that cover. I think that came up, the way we were told, came up as a way of trying to make healthcare accessible for all, even within the interior communities. So that's different. But here, they are all registered nurses who just choose to be in the community and practice their nursing in the community. So community community nursing here is very different. Community nursing, they do things like, for example, a patient had amputation, went to the hospital, had the surgery, and now is discharged home. So the community, they will be discharged to the GP and the community nurses. So what the community nurses is that, like, they have like an office where you go, and then you'll be told, okay, go here, and you have so patients and so road who just came back from the hospital. So the patient may need like wound dressing. When a patient is discharged from the hospital, they still need their injections, they need wound dressing, they need to take their tablets. And these patients, most times they are old. So these community nurses, they go to take care of these patients in their own home when they are still in that acute phase. And then when they are okay, they can now discharge them. Some of them that have to be like this, handed over to like the home care nurses, or the what we call the carers. The carers are now the one going, because carers will not go and do wound dressing. They will only do like physical care, like give them a bath, prepare food for them, brush their hair, wash their hair, and change their nappies and stuff like that. While the nurses will take care of the nursing aspect of it, if they need injections, their medications, their wound dressing and stuff like that. So there is a clear demarcation the way it is here than the way it is in Nigeria. So yeah, that's when we talk about community nursing. But public health nursing in Nigeria is different. It's also like the same thing here. But the only thing is that people that go into public health nursing, they are the ones that like maybe get to work with WHO, get to work in the immunization units, get to work in the primary health care centers, community health care centers, um, and stuff like that. So there are many specialties. As you go on in your career, you get to know the one you love. Don't just rush into doing That's what I tell people. If I have a junior colleague, don't just run because the people you finish school with are going to do this. You just want to do. Me, I knew from ab initio that I don't want to be a midwife. It's not because I cannot do it, but it's just not my thing. It's just not my thing. I think the reason I made that firm this thing is because of it's not everything you talk online anyway. It's the way you see, you know, when you see the way people are cared for in the hospital, because I am one person that is very particular about caring for someone, not minding who you are. And you see the care that some people, some um pregnant women receive because maybe their husbands, as they came to the world, they are buying things here and there. They are acknowledge, they know, oh, that is related to so person, and all those things is really so obvious in the general medicine, and I don't like it. I don't just like it. I think that's one of the things that made me to say no, I can never be a midwife, because I cannot stand to see a woman in labor, and I didn't want to. So I went straight to do my ophthalmic nursing. I went straight. And also I had a mentor who actually, I saw what he was doing as an ophthalmic nurse. I saw he was heading the unit. I saw the benefit. I saw the independence you get when, if you want to be an independent practice. It gives you, ophthalmic nurse gives you, anesthetics nursing gives you the opportunity to be an independent nurse. I have a senior colleague who is an anesthetics nurse, is a female. She said when she went to do it, her colleagues were like telling her, wow, what are you going to do in anesthetics? Why not come? Let's go and do midwifery. She said no, she wants to be, she wants to do a job that she does not have to be under somebody all the time. She has her own course to be. And she was, we happened to work together in the hospital where I was working before. In the theater, I was in eye theater. So most times, our eye surgeries, most times we don't really use like general anesthesia. So general anesthesia has like specific people they give it to. So only when it gets to those kind of people, that's when the service of an anesthetist is needed, and the hospital usually called her. And when she comes in, she said, this is why I love my job. I can work for 2 3 hospitals at the same time, because and I decide when I want to go. So if you pick up your phone, I tell you my rate. If you pick up your phone, now I've diverted. I know if you were watching because of recognition of prior learning, I've said everything. Now we are going into discussing discussing specialty. If you pick up your phone, because like the hospital I was working with, she said the hospital, she told them that she's going to be charging 50% of what the patient is, I mean 30% of what the patient is paying. They said no, they were going to give her for anesthetist fee, they were going to pay her abi 2,000 per case. So she did a few cases with them, and then she got another offer somewhere who offered her more than 2,000 naira per case. And oftentimes the cases she goes to induce is majorly general anesthesia. So she now told them no, we have to devise a means. If I'm coming to do general anesthesia, this is the amount I'm charging per patient. If I'm coming to do this anesthesia, this is the amount I'm charging per patient. And they were like, no, 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 this is this. She left. They thought she would come back and beg them. She left. She said she left. She was just at home. She wasn't really having like jobs like that, but she had particular hospital who was willing to pay her what she offered. And then she was doing it. And then this hospital were literally begging her, because the doctors were already used. And when it comes to theater, you don't want to constantly work with different people. No, you don't want to. As a doctor, as a surgeon, at least I know that to a little level. You don't want to constantly work with different people, because when you work with a particular nurse, the nurse knows how you want your surgery to go. The nurse knows your steps. He knows when you drop this instrument, this is the one you want. If you are doing this kind of surgery, this is the kind of instrument you want in your pack. Every surgeon is completely different. So if you are in the theater and you have an anesthetist coming, the anesthetist should know when the doctor wants their patient deep asleep, when the doctor wants the patient a little bit awake, when the doctor wants the patient body relaxed and stuff like that. So you cannot keep changing. The doctor will now telling the hospital, you can't keep changing anesthetics for me. I am used to this person. How much is she asking that you cannot pay? You've already charged this patient. Why not give it to her? Okay. So it is good that when you want to choose a specialty that gives you that job fulfillment. Money is very good. Money is like I used to tell people that money can solve 99.9% of your problem. Luck, God, whatever thing you believe in will not be the remaining point one. If you have money, there's so many things that can be solved. But that does not erase the fact that you want to do the job you love, because no matter how much you get, if you don't love your job, you're going to be constantly frustrated. And that's the honest truth. So yeah, this is where I want to end this video because I have a friend to catch up with. This is where I want to end this video. I hope you like the video. I hope you enjoy it. Please help me share. um Help me share the video. Invite people to come to my YouTube channel. This is where you're going to get the gist. This is where you're going to get the gist. Invite people to like my YouTube videos. Come and subscribe. Watch my videos from beginning. I try to keep my. I know I'm not a very entertaining kind of person. So sometimes my videos could be. Let's talk about lifestyle. No problem. When next you see me live, ask me any lifestyle question. I know I'm not really a jovial. I'm not a jovial person. I may not really be that entertaining, but if you like videos, you will get sense from it. So see you all in my next video. Bye bye. How do I end this life now?